Good day. I am Meg-Kyla and I have recently completed my MSc in Anatomy at the University of Pretoria, focusing on shape variations of the ear in South African populations for facial approximation. During my research, however, we discovered that inconsistency exists in the literature regarding how to approximate the shape of the ear based on underlying hard tissue. Therefore, today I will be presenting a section of my MSc research titled Correlations Between the Ear and Other Facial Features for Compound Craniofacial Approximations, or CFA. Facial approximation is a field in forensic science aimed at recreating a person's antemortem appearance. These approximations are then released to the public in hopes of the person possibly being identified. Traditional methods consisted of manually sculpting a face over a dry skull, focusing on muscle attachments, curves, and ridges on the cranium to estimate the shapes and sizes of facial features. These traditional or manual methods have, however, been largely criticized due to their inherent subjectivity and lack of standardization, as each estimate still involved a large portion of artistic free will.
Today, the field moves towards automated methods of estimation, propelled by advancements of 3D medical scanning technologies that allow for the study of both hard and soft tissue structures. By correlating selected cranial landmarks of the unknown skull to soft tissue structures, a facial estimate can be generated from a database of individuals matching the unknown's biological profile.
Computerized software for approximating facial estimates aid in eliminating subjectivity associated with manual input and minimizes human error. However, subjectivity can still be present in the operator's placement of the landmarks on the 3D images. Thus, automating the landmarking procedure as well can further eliminate subjectivity.
The ear specifically is a complex soft tissue structure. It is not considered vital for an approximation, but does contribute to overall accuracy. The ear consists of the cartilaginous pinna superiorly and the fleshy lobule inferiorly. The external auditory meatus opens up into the concha. The main region of interest underlying the ear is the temporal bone. The temporal bone is highly irregular in shape, forming the transition between the cranial wall and base. It consists primarily of the external auditory meatus, the zygomatic arch, and the mastoid process. Unfortunately, unlike other facial features such as the nose, the temporal bone does not exactly provide a lot of guidance as to how the ear looked when trying to estimate its shape and size. But in 1955, Russian anthropologist Mikhail Gerasimov suggested guidelines for approximating facial features, including the ear from dry skulls. However, in recent years, his studies have been validated and mostly disproved, most notably by the 2012 study by Guillemot and colleagues. Gerasimov set out various guidelines for approximating an ear, including angling the ear according to the ascending ramus, or the bridge of the nose, that the ear and the nose are the same height, that the breadth of the ear is half of its length, or how a mastoid process's orientation can influence the external rotation of the ear, and how mastoid processes' directions influence lobe attachment, with straight mastoids leading to attached lobes, and mastoids that project anteriorly leading to free lobes. All of these guidelines were, however, proven wrong.
Guillemot and Stefan suggested predicting ear heights based off regression equations derived from CT scan data, and later introduced a 3D software that generates a facial estimate using data collected on CT scans through geometric morphometric methods. However, the automated ear estimates resulted in error rates of up to 8 millimeters when compared to the individual's actual ear. They did, however, find significant positive correlations between the external ear and the temporal, orbital, masticatory, and mandibular matrices. Correlations between the auditory matrix and other soft tissue facial features, however, still remains unexplored. Yet, guidelines for facial approximations, especially on the ear, rely heavily on features such as the soft tissue nose. Thus, the aim of the study is to assess correlations between the shape of the ear and other hard and soft tissue facial features. Since human facial features are proportional to one another, the study will look at correlations between the shape in the ear and that of the eyes, nose, and mouth, as well as the hard tissue structures, so not only the external auditory meatus, but also the anterior nasal aperture, orbits, zygoma, and maxilla. The data used for this study consisted of 116 Cone Beam Computed Tomography scans retrospectively collected from the Oral and Dental Hospital at the University of Pretoria, as well as Kruinkkloof Life Hospital in Pretoria. The use of existing diagnostic scans prevents the need to expose individuals to unnecessary radiation. We were unfortunately limited in sample sizes due to scans being collected from a hospital, and many individuals presented with trauma or pathologies that excluded them from the study as it affected their facial morphology in some way. The final sample consisted of 46 South African males and 70 South African females between the ages of 18 and 80.
CBCT scanning is a non-invasive scanning technology that provides detailed representations of anatomical structures. The individual is scanned while standing, thus also eliminating the supination effect where soft tissue is displaced posteriorly when a person lies down. A 3D image is gathered using an X-ray source and detector fixed to a rotating gantry. The CBCT images were then imported into MeVisLab in DICOM format for processing. As with regular radiographic slices, grey values represent the density of the structures observed, with the lighter grey values encoding denser tissue structures. Using the half maximum height quantitative iterative thresholding method by Spoor and colleagues, hard tissues were segmented at threshold values of 900 to 1500 and soft tissues at 250 to 500.
Geometric morphometrics is a field that focuses on biological shape analysis using Cartesian coordinates of anatomical landmarks. Anatomical landmarks are defined by specific biological structures and are thus consistent across all individuals in a species. For this study, we followed the nomenclature sent out by Capel and Stefan in 2016, where craniometric landmarks will refer to any landmarks placed on the hard tissue surfaces of the skull, and capullometric landmarks will refer to soft tissue landmarks placed on the facial features.
Geometric morphometric methods use mean shapes of structures, patterns of variation, and group differences in shapes formed by these anatomical landmarks. The shape of an object is determined by its geometric properties, which are preserved in the landmark coordinates. These coordinates are thus invariant to change in the orientation, position, or size of the object, allowing the shape of the biological structure to be distinguished. Through a process known as a generalized Procrustes analysis, the landmark data on each specimen can be superimposed, scaled, and rotated to create one mean or average shape of a structure. The following matrices were assessed on the soft and hard tissue surfaces. A total of 69 capillometric landmarks were indicated on the soft tissue templates. 19 landmarks on either ear made up the soft tissue auditory matrices. 4 landmarks were indicated on the eyes. 8 landmarks were indicated on the mouth. And 19 landmarks on the nose. The nose is of particular interest as it is commonly used to estimate ear size in manual facial approximation methods. The hard tissue region of interest was indicated on the skeletal surface. The mid-facial matrix consisted of 43 craniometric landmarks that were then further divided into the orbits, the nasal bones, the anterior nasal aperture, the left and right zygoma, and the maxillae. Matrices using sliding landmarks were also indicated along the exterior curves of the left and right EAM, the left and right orbit, and the anterior nasal aperture. For accurate analysis, each curve is required to have the exact same number of landmarks along the curve, and all curves must start in the same place. An existing craniometric landmark was selected as the starting point for each sliding matrix. The EAM was outlined with the sliding landmark starting at porion for both left and right sides. The anterior nasal aperture was outlined with sliding landmarks starting from rhenion at the most inferior points of the internasal suture. And lastly, the orbit was outlined with sliding landmarks starting from mid-supraorbital on either side. The automatic landmarking procedure used for this study was first suggested by Claes and colleagues in 2006 and recently tested and published by Riedel and colleagues in 2019. A reference template can be generated in a procedure similar to generalized Procruste's superimposition that warps every individual surface to a single template. For the automatic landmarking procedure, the landmarks for each matrix were only placed on the previously generated template, and then the MeVisLab module can automatically project the landmarks onto every other surface in the sample with the simple click of a button. The reproducibility of the 8 landmark matrices automatically placed in the study was assessed using dispersion error. Dispersion measures the average distance between a landmark's mean placement and all subsequent landmark placements. Landmarks are considered suitably repeatable if dispersion errors are under 2 mm. All results in the study were acceptable except for the left orbit, which displayed unusually high dispersion in the intra-observer error test when compared to the other matrices. Overall, the orbits were the least repeatable when placed automatically. Statistical analysis involved assessing correlations between the mean shapes of the ear to all other matrices. Evaluation of covariation between matrices was calculated with 2 blocks partial least squares analyses. This analysis assesses the degree of association between 2 blocks of Procruste's aligned coordinates. The shape of all soft and hard tissue matrices are positively correlated to the shape of either the left or right ear, with only the correlation between shape of the ear and the eyes not being statistically significant. The strongest correlations were found between the shape of the left and right ears and their corresponding EAM, the external nose, orbits, and in the midfacial matrix, the isolated orbits and zygoma. The eyes and mouth shape have the weakest correlations to the ear, making the nose the only soft tissue facial feature with a strong correlation.
Although strong correlations were observed between the shape of the ear and the shape of the underlying EAM for both left and right sides, the temporal bone itself does not provide a lot of guidance when estimating the size and shape of the ear in facial approximations. Throughout the history of facial approximation, most researchers relied heavily on other facial features such as the nose when predicting ear size. The results of our study have further strengthened the relationship between these two facial features by also finding strong positive correlations between their shape. Strong correlations between ear shape and the shape of the hard tissue components of the midface are also consistent with the results by Guillaume and colleagues' study, which observed significant positive correlations between the shape of the ear and the hard tissue orbital and masticatory matrices in a French sample. However, correlations between the ear and other soft tissue facial features were weak in comparison to the hard tissues of the nose, indicating that the midfacial skeleton and the external nose could be the most reliable when estimating both ear shape and size. By using CBCT databases, large sample sizes can be assessed using both hard and soft tissues of the same individual, allowing for accurate correlations between surfaces and to assess the individual features. The continuous development of computerized databases will aid in the generation of faster, easier, and more accurate facial approximations for unknown individuals through correlating selected cranial landmarks to soft tissue representations. Understanding how the shape of the ear correlates to the underlying hard tissues and other facial features will guide researchers towards more accurate methods for approximating the ear, especially if the temporal bone does not provide enough information. We suggest that the ear be approached in a compound approximation method, relating the shape of the ear back to other facial features such as the nose, which can be approximated more accurately. The results of this study will aid in the developing of 3D facial approximation programs, but are also applicable in pre-operative planning. Future expansion on this research can further investigate how these correlations in shape can lead to estimates of one facial feature being derived from another. More comprehensive research into the correlations of the rest of the facial features to one another will also aid in the development of a more holistic compound facial approximation program.
Thank you for your time. If you have any questions, please feel free to contact me over email or via any of my social media channels throughout the Bio and Talks conference. I would like to extend my acknowledgement to Dr. Sarel Buerta and Dr. Andre Ace and their respective teams at the hospitals where we acquired the scans for this study. I'd also like to extend a special thank you to the organizers for the opportunity to present this research. A list of references will be available on request.